I am pregnant. What are my choices? How old do you have to be to get an abortion?
What about adoption?
Where can I get
what about adoption?
Are there places where I can get help for being a single parent or even a teenage mother?
My name is Lelania Howard. I'm the community organizer at NARAL Pro-Choice New York. And at NARAL, we work on the political, legislative, and community level to ensure that all people have access to safe and legal abortion and the full range of reproductive health services and choices. So Choices was a series that we organized at NARAL this year in 2009, and we partnered with 16 different community-based, statewide, and national organizations to really expand what we mean when we talk about reproductive choice. And we highlighted the work that's being done to make sure that all reproductive choices are available to all people. We held our first installment of Choices Emergency Contraception, in partnership with co-sponsors the National Institute for Reproductive Health, Students Active for Ending Rape or Safer, the New York City Alliance Against Sexual Assault, and Harlem Health Promotion Center. Presenters shared information about emergency contraception, how to get it, their successes, and lessons learned, and what everyone can do to make EC a supported and accessible reproductive choice for all.
Well, now that emergency contraception is available over the counter, it's very exciting. Many more women have access. However, unfortunately, a large group of women still don't have access to EC in a timely manner. And that includes young women who are under age 17 who still don't have over-the-counter access. Also women that don't have a government-issued ID that can prove their age, and so that includes a lot of immigrant women. And that also low-income women who may not have the $50 that it costs on average to obtain EC, and their public health insurance program may not cover it.
In honor of Mother's Day, we held Choices Parenting to highlight the work being done around New York City to ensure that all women have access to and are supported in their choice to parent. Sisters on the Rise, Baby's First Home, the Red Hook Initiative, and the New York Civil Liberties Union all co-sponsored and presented.
I hope women, especially young women, gain access to reproductive health, which may be birth control options or GYN choices or anything that has to do with the reproductive system. I help them navigate that. And I also run a young mothers program for teen mothers in Brooklyn. Being a teen mom myself, I was a teen mom, being shut out of the educational system or feeling that you need to go makes you not want to return back. And then if you don't know where to go, you're stuck.
In honor of Pride Week, we held Choices, Reproductive Rights, and the LGBTQ community. Co-sponsors included the Lesbian, Gay, Bisexual, and Transgender Community Center, the National Coalition for LGBT Health, and Lambda Legal. Presenters from all these organizations spoke about the work they do each day to ensure that all people are supported in their choice to parent and start families, that the unique needs and experiences of LGBTQ individuals are affirmed by healthcare providers, systems, and policies, and that the rights of LGBTQ individuals to reproductive freedom are upheld and fought for within our legal system.
One thing is that both the reproductive freedom movement and the LGBT liberation movement are at their cores about the freedom to express our sexuality.
It's generally turning the issue of choice on its ear by making the discussion not being about straight women's right to an abortion, but a queer person's right to have a family. Men who have sex with men are still excluded as sperm donors by almost all sperm banks. The cost of accessing reproductive technologies is still even more astronomical, and insurance coverage is still very limited.
Presenters at our fourth Choices Abortion, shared the work they do each day to provide financial assistance to low-income women who cannot afford to pay for an abortion, to support and counsel women after they have an abortion, to ensure that all women have the health care coverage and access necessary to obtain reproductive health care, and to work on the legislative and political levels to ensure that all people have access to safe and legal abortion.
Our real focus is to make sure that we not only secure the legal right, because we always have to fight that, but to make sure that access is a reality for women, regardless of their economic status, their family situation, wherever they live in this country, so that more states hopefully will be like New York.
The final installment in our Choices series, Choices Adoption, highlighted the work being done to ensure that all people have access to and are supported in the process of adoption. Presenters shared their experience with adoption and the work they do to ensure that birth mothers are heard, that professionals are trained to include adoption when options counseling, that the socioeconomic factors underlying transracial adoption are discussed, and that all individuals and families, regardless of race, sexual orientation, or class, are recruited as adoptive parents.
Our work is about finding homes for the babies in our care, certainly, but providing services to the pregnant women who come to us for help. Very often, having the conversation with the social workers is the first opportunity for someone to really talk about everything related to this crisis that they're in. It's very much acknowledged by the agency as central to the work with women who come to us who are pregnant. They're considering adoption, but they're considering that as it should be one of a number of options.
Transracial adoption is a phenomenon. White middle-class people have and continue to adopt children of color in significant numbers. Over 200,000 children of color have been adopted in this way in the U.S., both internationally and domestically. It is worth examining the reasons for this large number of transracial adoptions.
I think that there's a lot of conversations that people have about culture and identity and the need to have relationships, you know, with people of the ethnic or cultural background that your adopted child is, and I think that that's really great, but I still think there's a lack of understanding of sort of a larger systemic, you know, just the systemic issues of racism and sort of how that functions and how it works. And I grew up in Holland, Michigan. Everyone was very fair-skinned, and there I was, and I was like, I don't look like these people. And so there was just like, you know, this internalization of that the problem was with me somehow, that there was something wrong with me. And there wasn't anywhere to talk about it. There was nowhere to go. Like, nobody could have this conversation with me, really. It was a huge relief. I mean, not that the personal work still needs to kind of happen, but that I could put this in a larger context and understand that the problem actually was about, you know, sort of all of us and how we've been conditioned and how we've been educated.
I hear the song.